Welcome to the Celiac Diva!
Hi everybody, Lauren Lucille Vassar here from the Celiac Diva, and today's topic is, can you be overweight and have celiac disease? And the answer is a resounding and loud yes. Yes, you can. And I definitely want to debunk the myth today that to have celiac disease, you must be underweight. Now, a lot of people are underweight due to malabsorption and malnutrition. They may be severely underweight. And it's my personal opinion that since these patients are often diagnosed, not all the time, but often diagnosed more quickly than someone who is overweight, that has become the face of celiac disease. However, we're going to debunk that myth because you can definitely be overweight, normal weight, and also have celiac disease. And the question may be, then why is that? Why, if I'm not absorbing anything, how can I be overweight? So I wanted to give you a few reasons why you or somebody you love may be normal weight or overweight and have celiac disease. One of those is fat malabsorption. When you have celiac disease, often a patient may not absorb omega-3 or essential fatty acids. And so as a result, they become extremely hungry. They're never full, and they have a high caloric intake. And then the body will try to store that fat, thinking that it's not going to be able to use that fat, or thinking that it's starving. The body starts to store as much fat as it can. So that can definitely cause a huge problem and cause you to gain weight. To further complicate the issue, many celiac disease patients have low pancreatic functions, and the pancreas increases your ability to be able to burn stored fat. So if your pancreas is all jacked up and you have stored fat, and then on top of it, your pancreas isn't working properly, so you're not able to help really burn that stored fat, you can kind of have a double whammy, and somebody may continue to increase their weight. So that can definitely cause a lot of problems. Celiac disease also can cause thyroid disorders. The thyroid secretes hormones that help you control your body's metabolic rate. So if celiac has caused you to have some sort of thyroid disorder, you may not be properly secreting those hormones, and your metabolic rate may have slowed down. So that can definitely be a problem. So also, by the way, if you have celiac, make sure you've checked out your thyroid and see where it is and know where it is, so that you can kind of get that back in track and everything. Another thing that can happen is you may have an iodine deficiency, especially since celiac disease causes severe malabsorption. Iodine is used to help the thyroid function properly. So if you have an iodine deficiency and your thyroid isn't getting that iodine, then your thyroid again isn't able to do its work properly. So then you have some patients who are dealing with all of these components, which just means they feel like they can never catch up, or they can never, no matter how much they work out or no matter how much they eat right, they feel like they can't get their weight, to stabilize. And so it can definitely cause a lot of confusion during diagnosis, because a lot of doctors think that you have to be overweight and have celiac disease, and it's totally not true. So don't let anyone tell you otherwise. Remember that you can be overweight or of normal weight and have celiac disease. And make sure you just stand your ground, and let's debunk this myth and know that celiac disease is an autoimmune disease, and it can look like anything. So thanks so much for stopping by, and until next time, have a wonderful gluten-free day.